so that we can go ahead and share it out later. But welcome everyone. Happy afternoon. I hope you're having a great Wednesday. We are here to share some information about SNAP in schools and engagement strategies for Kentucky health centers. Some quick housekeeping. All of you are in participation mode, so if you have any questions, you should be able to unmute, raise your hand, and also use the Q&A or chat icons on the bottom of your Zoom control panel. Just making sure that you have the chat set to all panelists and attendees to make sure that everyone receives the message. If you're interested in closed captioning, you should be able to press the CC button. And then we just ask that you complete our poll questions at the end of the presentation to let us know if you're interested in receiving additional materials about this RFA or any outreach materials that can be useful to share immediately. And with that, I'm happy to pass it to my colleague Addie.
All right, thank you so much, Harper. So just wanted to say hi and thank you for joining us today. You'll hear a little bit from me. I'm Addie Vanzwell. I'm a vice president at the School-Based Health Alliance. You just heard from Harper. She'll chime in a little bit later as well. We also have Sarah Mills, who's a senior manager through the health systems program at Share Our Strength. And then we will hear from Chelsea Brock, who is outreach manager for Feeding Kentucky. So we'll all kind of go back and forth a little bit throughout this presentation. Feel free, like as time goes on, feel free to ask questions, unmute. We definitely want this to be an interactive presentation. So, as far as our agenda, would definitely love to hear from you. So I thank you, Sarah, for already prompting people to do this, but just put your name, your organization, your health center, where you're coming from. Would love to hear it. We've done some welcome and reminders already. We'll shift into talking a little bit about our partnership. So the School-Based Health Alliance and Share Our Strength's No Kid Hungry campaign has been working together for the last several years and have done some amazing work. So we're really excited to share that. And then we'll start kind of diving into the meat of the discussion, talking about SNAP outreach, Kentucky specific information, and an upcoming request for applications. So, next slide. So, at the School-Based Health Alliance, if you are not familiar with us, we are the national voice for school-based healthcare. We work to improve the health of children and youth by advancing and advocating for school-based healthcare. We truly believe that when health and education come together, that a lot of things can happen. So we do a lot in terms of training, technical assistance, webinars, communities of practice, policy advocacy work, you name it, we do it. So that's a little bit about us and our background. Sarah, I was wondering if you wanted to unmute and talk a little bit about No Kid Hungry.
Course. Thanks, Addie. And hi, everyone. I'm so glad that you could join us today. As Addie mentioned, I'm Sarah Mills. I'm a senior manager on our health systems team at Share Our Strength. Share Our Strength is a national anti-hunger organization, and we created the No Kid Hungry campaign to really work with states to ensure that every child gets the healthy food that they need to thrive. So we work across all 50 states with organizations like state agencies, school districts, nonprofit organizations, healthcare organizations, and offer technical assistance, grant funding, support for those organizations to connect the families that they're working with to food and nutrition programs. And now I think I'm handing it over to Chelsea to talk a little bit about Feeding Kentucky.
Yes, hi everyone. Chelsea Brock, the outreach manager for Feeding Kentucky. Our mission is to work collectively to create a hunger-free Kentucky. We are the state partner association under Feeding America, and we provide support to the 7 major food banks in Kentucky. We do all kinds of different things to support that work, including our Farms to Food Banks program, work with school lunch and other summer EBT and summer meal programs, youth services programs. And my role specifically is SNAP application assistance and support. And then we also have some advocacy folks who do food justice work to help with the policy behind all of those programs. So if you would like more information, feel free to go to the website that's listed on the screen. And we've got a really great website that has a lot of different info.
All right, great. Thank you, Chelsea. One thing that I wanted to highlight here is kind of our collaborative vision between No Kid Hungry and the School-Based Health Alliance. As I mentioned before, we've been working together for several years now, and really thought that it made a lot of sense to work together, right? So, at Share Our Strength, they're really focused on keeping kids hungry and or not keeping kids hungry, making sure kids do not go hungry, keeping them fed. And school-based health centers are a really great way to provide a resource and to encourage staff and school staff to engage and refer families to federal nutrition programs. Our partnership really did make a whole lot of sense in the beginning to help support kids and families get the access to food. If we go to the next slide, we can talk through a few of the things that we've done. So we started talking, I want to say back in 2021, but back in 2022, we launched a learning network across the country. And so we engaged 16 school-based health centers representing 12 states. And what we really did here is we provided a lot of training meeting monthly. We worked with them to support different school projects and different school health and food projects in those states. So we did that. And then, really, from all of the lessons that we learned, we developed and launched a toolkit. So that really highlighted kind of promising practices, lessons learned, what the best practices were in terms of like making sure kids and families could get connected to programs. And then as we kind of move forward in our work, we shifted our focus to working with two specific states. So we had a call for applications, and Ohio and Colorado had applied, said that they were interested in expanding food access to their states through their school-based health centers. And so what we helped support them do is really kind of launch their own statewide learning networks. And also during that time, we continued to support 10 of the original school-based health centers who were in our initial learning network. So we held quarterly meetings and met with them, and really continued to support their work at those individual states. Next slide. So in kind of moving forward, we really supported the Colorado and Ohio initiatives kind of through their initial launch of their learning networks, and then really helped around like sustainability and quality improvement and really gathering information about how they were screening for food security in their school-based health centers. We also launched a national food security survey. So this is where we put out a survey to the encouraging all school-based health centers across the country to complete it. And we also launched a series of webinars. So we did one that was very specific to kind of SNAP in Schools work. We are not SNAP in Schools, but just SNAP work. We also had one on food access programs, so the continuum of what that may look like and practical tips and strategies. And then we also talked a little bit about the intersection of mental health and food and mood and how that impacts kids in our schools. And so as we've moved this work forward, we are now focusing on our SNAP in Schools work. And so we are exploring the launch of a SNAP outreach program in Kentucky and North Carolina, and we're really excited to talk more about that later. So at this time, I will pass things over to Chelsea and Sarah to talk a little bit more about SNAP outreach.
Okay, I think the next few slides are me. You can go on to the next one, Addie. or whoever's controlling the slides. I think that's Harper actually. So this slide is the food insecurity rate nationally and versus Kentucky, and we've got the overall rate on the left and child food insecurity specifically on the right. As you can see, Kentucky has slightly higher rates of food insecurity overall and for children. Next slide. But even though Kentucky has a higher food insecurity rate, we have a lower SNAP participation rate. Keep in mind these numbers are of people who are eligible. This is not saying that 83% of Americans receive SNAP, but of the people who are eligible to receive SNAP, only 83% nationwide are receiving it, and only 77% statewide are receiving it, which means that 23% of eligible Kentuckians are leaving those benefits on the table. We also know that nearly 62% of SNAP participants are in households with children, which is why we're doing a lot of our work to target families with kids, because we know that a lot of those are the people who need that extra help. Some of them may not have needed help before, but now with extra mouths to feed, they do. And some families have higher participation gaps, such as mixed status families, those folks where maybe the parents are not in eligible status, but the children are, or multi-generational families and seniors raising children. Again, these are the folks that often will say that they've never needed help before, and now all of a sudden they do, but because they've never needed it before, they've never explored that, they don't know how to go about doing it. Next slide. So this one, I want to hear your thoughts on why you think SNAP is important. So feel free to come off mute or post in the chat the reasons that you think SNAP is important. No one? Okay. Well, if you don't know, I'll go ahead and tell you. Okay, let's see. Nutritious food for families and children supports health development. Absolutely. And that's one of the reasons that we think you guys would be, great folks to partner up with to get that information out there, because you know the importance that SNAP can have for families who need that extra help getting nutritious foods. Nutritious food is expensive, and groceries are way more expensive overall than they have been ever before. So getting the healthy stuff is sometimes out of people's reach. So SNAP can help with that. Anyone else? Okay, you can go to the next slide. So here are some other reasons. We already kind of covered the first one. It helps prevent and ameliorate food insecurity and improves health outcomes. Also, money that families would have spent on food, if they receive SNAP, that money can go towards other things like rent, utilities, medicine, transportation, because we know that hunger doesn't happen on its own. It's a combination of things that are happening. If you're experiencing food insecurity, you're probably also struggling to pay your other expenses as well. Also, local grocers and farmers rely on SNAP, especially in lower income areas and more rural areas. Sometimes those small stores in lower income areas are primarily funded by SNAP purchases. And food banks and pantries can't do it alone. I spent 7 years working in a food bank doing SNAP outreach before I came to Feeding Kentucky. And for every meal that a food bank provides, SNAP provides 9. So anytime there's a huge change and you hear, oh, well, food banks can help those people when that happens, there's no way for food banks to totally replace SNAP. It's impossible. They do not have the capacity for that. So we really do need SNAP to provide that food. Not to mention that food banks have what they're able to have, what they're able to purchase, what they get through food donations, but SNAP is a good resource for culturally appropriate foods, diet appropriate foods. If your religion restricts the types of foods that you can eat, SNAP is what helps you get what you want, what your family will eat, not just what the pantry has on hand. And then when you think about one SNAP application is not just one meal. One SNAP application is all of the meals that you will get while you are enrolled. So with the SNAP Impact Calculator that is provided by Feeding America, and I don't know how they get their algorithm. I just type in the numbers and this is what it gives me. But one SNAP application equals about 749 meals and almost $3,000 in benefits. So that's huge to be able to do one SNAP application in 20 minutes and have that lead to that many meals is a really big lift with really little effort. It also generates $4,361 in economic activity because when someone spends that SNAP money, that money is used by whoever they're paying towards, the grocers and the people who make the products who get a piece of that money, and then they're putting that money back into the economy. So SNAP actually supports and stimulates the economy. Next slide. It also fuels learning. I don't know about you guys, but if I'm hangry, I can't focus on anything else except I need food now. And children are the same way. They're not able to focus on the lessons and listen to their teachers when they're hungry. And the research supports that. It shows that children with access to SNAP are more likely to be in good health, which means they have fewer absences and less missed school due to illnesses and doctor's appointments. They're also at lower risk for developmental delays, and they have 25% fewer medical costs than people in the same socioeconomic status who don't access SNAP. SNAP participation can also lead to gains in reading and math, decreases the likelihood of behavior problems in the classroom, and increases the chance of high school graduation. So all around good for everyone involved. Next slide.
All right, I think this is where I jump in. Thanks, Chelsea. So, because of all the things that Chelsea just mentioned, we know the enormous, impacts that SNAP can have on a household, on, a child's well-being, on their academic success. We have been really working to embed SNAP outreach and support for SNAP enrollment in places where families already are. Some of the barriers to accessing SNAP can just be, that lack of information or, the time it takes. And so if we're able to approach it from kind of this like no wrong door, wherever families are going most often, if they can get support for SNAP application and enrollment, that's what we're looking to do to make it as streamlined and easy as possible for folks to access these benefits that they're entitled to. So we have been doing a lot of work over the last few years with school districts on SNAP outreach and enrollment campaigns. So some of the things that we've found to be successful in these campaigns is just providing multiple touch points. We know, especially for families who haven't, utilized SNAP in the past, they might need many different, exposures to this information. We know that going through trusted messengers is one of the best ways that we can reach folks who may be hesitant to enroll in SNAP or who have, other barriers to enrollment. So being able to kind of incorporate the SNAP information into typical school communications, using those trusted messengers like, school personnel or health center providers, providing, opportunities for SNAP enrollment at, regular school or, clinic activities. Also making sure that there's a connection between the school and folks who can provide that hands-on support. So even if the school or school personnel can't be there to walk a family through the entire process, making sure that they can provide that warm handoff to someone like Chelsea, so that folks have that person to answer their questions and to really support them through the whole process. Schools have also done some targeted outreach. So in addition to sort of broad campaigns, just getting, blasts of information out through, robocalls or text messages. They've also done some, matching of data. So understanding what families are more likely to be eligible for SNAP and really targeting those folks with more information. And I guess one thing I would just add too is that, given given all of the recent changes to SNAP, given the, real and legitimate, concerns that folks have about SNAP or about participating in programs right now, it's more important than ever for those trusted messengers to be able to provide, clear information and communication about these programs. You can go to the next slide, Cooper. So, the other thing that we found in doing this work is, partnerships are so important. I mean, they're important for so many different programs. But really, we found that school districts who were doing these SNAP outreach campaigns really benefited from having the support of multiple partners who were providing similar messaging to really surround families with that consistency. So working with food banks, bringing, folks into the school to provide support, working with immigrant serving communities, community action agencies, other nonprofits, libraries, health departments. There are so many different partners that can come to the table. But one thing that we noticed and we're continuing to learn as we were doing this work is that often a critical partner was not at the table, and that was school-based health centers. So, really trying to marry the work that we had been doing with School-Based Health Alliance, and, we had been working kind of targeted with school-based health centers to do food insecurity screening or to support food access, but it was sort of in this bubble by itself. And so just thinking about how we can bring all these different partners together to really surround families in the school setting with all the trusted folks that they interact with there. So I am actually gonna, I think, turn it back over to Chelsea so she can talk more about the SNAP in Schools work that's been going on in Kentucky, and then we'll get into how SBHCs can get involved.
Yes, thank you, Sarah. Definitely partnerships are super important. Feeding Kentucky is a statewide organization, so I can do SNAP assistance and outreach in all 120 counties. I am also one person, so I can't be in 120 places at once. So I rely on partners immensely to get me referrals and connected with people who can pass that information along and spread awareness about the resources that are out there. And also I oversee the outreach at 3 partner food banks that are doing SNAP outreach and application assistance. And those are God's Pantry Food Bank, which serves Central and Eastern Kentucky, Feeding America, Kentucky's Heartland, which is Western and I think some Central Kentucky as well, and Southern Kentucky. And then why did it just fall off of my brain? Oh, Dare to Care, which is based in Louisville. Theirs is a little bit different because right now they're only serving the people that come in for emergency food and offering those folks SNAP assistance. But I think their program's going to be growing too. So if you're in the service area of one of those folks, I could connect you with the person that is local to you as well. And then I'm going to go into a little bit about what the SNAP connector role looks like. You may have also heard the term SNAP coordinator, SNAP assister. We all help with SNAP. The connector term specifically refers to someone who has gotten approval from DCBS to partner with them on this and taken the trainings to have access to the online portal. And what a connector has access to in the Connect portal is a little bit more than what the average person would have just applying on their own. It's still less access than what a DCBS, Department for Community-Based Services, caseworker would have. So there are still some things that have to go through DCBS. I like to say that I can hold their hand up to the finish line, and then there's a couple of things they have to do on their own with the caseworker. But these are the stages of SNAP assistance. It's going to start with outreach or referral. However, we're first getting in contact with the person we're going to be assisting. We always pre-screen folks just to make sure they're likely to be eligible because we don't want to waste anyone's time or efforts. And then there's the application itself. Typically, we're going to do those online, and that gives us a lot of access to other things that we can help with. But if the online application is unavailable for whatever reason, there's a couple of reasons that someone may not be able to apply online. We can do a paper application as well. We can help upload documents. This is a huge one because the initial application itself isn't too bad. Most people can get through the application, but it's all of the things that come afterward, the paperwork, the interview, where people fall through the cracks. So we can help people upload those documents. We can check what they still have left to do, to turn in. We can check if those documents that they've already submitted have been approved or denied, and if they were denied, what was wrong so they can fix it and resubmit it. They do have to do an interview, which this step does have to be done by a state caseworker. They can do this over the phone or in person. And that's just going to go a little bit more in depth into the questions on the application. We also, of course, can assist with questions or concerns. The approval or denial is going to come from the SNAP office. And then we follow up with every single person that we do an application for. I will reach them however they prefer to be contacted, phone, text, email, to try to get back in contact with them, make sure that application went through smoothly, that they completed all of their steps, and if they need any additional assistance, we can provide that. And then when recertification rolls around, which that time period varies depending on a person's situation, but we can also help with the recertification. So that's the typical progress of the whole thing. Next slide. These are the typical barriers to SNAP access that we usually see. They generally break down into these categories. Awareness, and that's referring to the program itself, all of the eligibility requirements, and what help is out there. They might be aware, most people are aware, I think, of at least a basic idea of what SNAP is, but they might not know how to apply for it. They might not know that there's help out there to assist them with that. There is a huge stigma around SNAP, especially right now. And people, whether it's their own internalized stigma, how they feel about the program, or how they think others will judge them for being on the program, that can keep people from applying. So as much as we can do to get the information out that, there's no shame in asking for help, that we know that the people who are actually receiving SNAP are not what some folks would have you believe is what a typical SNAP applicant looks like. It's mostly people who are families with children, elderly, and disabled folks are the majority of folks that are on SNAP, or working, but their income is still not enough to provide their basic needs. Physical access, even if they know everything they need to know, they may not be able to access the program because the hold times on the phone are too long and they work during the times when the office is open. Or maybe they have transportation or mobility issues that prevent them from being able to turn in their paperwork. Maybe they don't have reliable internet or the knowledge to use the online system. And then personal experience, if they've tried to apply for the program before and have had a bad experience with it, they're not going to want to go through that again, especially if they feel like they were treated poorly during the process. And then also, this one has been a real pain lately, is policy around SNAP. The policy around SNAP is changing constantly, both within just the statewide rules and regulations and federally. And not only does this impact people based on just the rules themselves and who is eligible and who is not, but also because there is so much that is constantly changing, sometimes someone might be denied and then a month later, maybe they're eligible, but how would they know that? Or maybe they have been receiving SNAP and then something happens and now they're no longer eligible and they don't know why. So all of these barriers can prevent someone from accessing SNAP or make them feel like it's not worth the time or effort to go through it. So my job is to break down as many barriers as possible. DCBS can only have the capacity to do so much. People have to meet them where they are. I want to meet people, the applicants, the patients, the neighbors and families. I want to meet them where they are. So break down these barriers so that they can get the benefits that they need and deserve. Next slide. So I've been working with schools specifically with SNAP, and this was new to me. I just started when I started at Feeding Kentucky, which was end of April 2025, so almost a year, which feels crazy to say, but also sort of feels like it's been longer than that. So I don't know how those are both true at the same time, but they are. But my focus has been on schools and mostly with the family resource and youth services coordinators, or Friskies, the school nutrition directors, and just recently learned about the FRAMs who deal with the free and reduced meal applications, but mostly with the Frisks. And getting them to, number one, just educating about SNAP, because a lot of them, again, know what SNAP is, but they don't really know how the process works. They know that summer EBT is tied in with it, but they're not quite sure the differences between the programs. So just educating. I've done lots of presentations at conferences and on webinars. I've done tons of one-on-one Zoom meetings with FRISCs and school nutrition directors just to kind of talk through kind of what we're talking through now, the importance of SNAP, how it can help schools, and how we can work together and fit SNAP into work that they're already doing. So I have accumulated a pilot group of 38 schools across 9 counties who are going to be tracking SNAP outreach, specifically with the impact on the identified student percentage number, which is the number of students who are eligible for free and reduced price meals. Because the higher that ISP number is, it can help them increase funding and increase enrollment in other programs like summer EBT. That's a whole other presentation. I could talk about ISP and all of that for an hour just on its own. So I'm just going to briefly cover that. But if you have questions about that, let me know and I'm happy to give you more information. And also we're working with schools and now hopefully with you all because you guys are uniquely qualified to reach families in need of assistance. I think Sarah mentioned that you guys have a relationship of trust. So when you refer somebody, it's not just handing them a flyer and hoping for the best. They know that the resources that you're giving to them can be trusted because they already have that relationship and that rapport with you. And because SNAP is so stigmatized and so intimidating, that frequent interaction that they have with you, plus the trust that they've built, helps to make them feel more comfortable reaching out for extra assistance. And the familiar setting too can help make families feel more comfortable. And it can also reduce physical access barriers because even if they have those transportation and mobility issues, they've already worked out how to get to schools and how to get to your health centers. So if they need to come in person for something to you, they already know how to make that work instead of having to go to a whole nother place that they don't know where it is and they don't know how to get there and they don't know what their parking situation or if they need like a ramp or whatever. They don't need to go through all of that. They already know what they need to do with you all. Next slide. This is just an example of what our outreach materials look like. The flyer on the left is what we give out to the general public. I include the income guidelines on all of my materials because I can't tell you the number of times I've had someone say, well, I didn't think I was eligible for SNAP, but we make less than this. And they've been able to get benefits that they always just assumed they couldn't get. Our flyer is also available in Spanish, and we have an interpreter service with over 300 languages. So pretty much any language that's going to be spoken in Kentucky, probably we can get assistance with. And then the flyer on the right, it's front and back, is our SNAP in Schools flyer that was originally designed for our work with FRISCs and school nutrition directors, but it'll be adapted a little bit to make it more relevant to school-based health centers. And there will be some examples of that information a little bit later on. Next slide. And I want you all to know that we want to tailor this outreach to meet your needs. We're not expecting a huge lift from anyone. We know that you're all super busy already, so we want you to go at your own pace. We know that everyone's center is different. We used to say at the food bank, if you've seen one food pantry, you've seen one food pantry. I think that's probably the same for school-based health centers. When you've seen one, because they all have to function a little bit differently depending on their space, their capacity, their staff, their communities. So what works for one might not necessarily work for another, and we're just going to have to talk through that to see what would be best for you. And what I have found that really works is to just think about how you're already communicating with families and with patients now. So think about how you could fit SNAP outreach and referrals into the work that you're already doing so you can take a small lift but still have a big impact. Something that a lot of schools brought up that I hadn't thought about was they've started posting notices in Infinite Campus and Parent Square and those types of websites because that's how they communicate with families. So instead of handing out a physical flyer, they can post a notice on there. So think about that. And if there's something that we don't mention within this webinar that you think would be a great way to target folks or to implement SNAP outreach, let me know because I'm always open to hearing new ideas about that. And just keep in mind, there's no wrong or right way to do this. We want to be there to give you guys the support that you need to make this work and to make it succeed.
Great. Thank you, Chelsea. What we are going to get into now is how school-based health centers can get involved in this work. Chelsea sort of touched on it already, but we really want to make this accessible to you all, and to fit with, what makes sense for your school-based health center and where you're at, and how you might want to be involved. And so we did develop this levels of engagement. So there's, level one, which is basically what Chelsea was just talking about, general SNAP outreach. And that's something that you can, get started with right away. And then we have a couple of additional levels that would require a little bit more, capacity, investment of time, and that will be, we will provide a lot more, support and technical assistance for those levels. But just wanted to give you a general overview of, there's different ways that you can get involved depending on, your interest and capacity. Harper, do you want to go to the next slide? So for the general SNAP outreach, like Chelsea said, there's a lot of things that you can do that, hopefully are very low level, low lift activities that you could get involved with right away. Using the outreach materials that have already been developed, distributing those through your patients, using existing communication channels that you already have or ways that you're already communicating, posting things in your clinics. Providing, that communication in the routine interactions that you already have. So whether that's, putting it alongside consent forms or school-based health center intake packets. And so for those kinds of activities, we have all the outreach tools, and we've had a lot of experience actually with some of our previous work of really being able to adapt some of those materials for the school-based health center setting, and we can provide some best practices too, with how other school-based health centers have been able to, provide some of this outreach. Next slide. And I'm going to pass it to Addie to talk about the next two levels of engagement.
Awesome. Thank you, Sarah. And I think to kind of to that point around like the general outreach and things you can do now, our toolkit is really a great place to start if you're thinking of like, how do I even begin to address food security in school-based health centers? Our toolkit has a lot of different examples and different stories, and there's a section specifically on SNAP and summer EBT and all of that. And so definitely encourage you to take a look at that if you have not seen it before. But to talk through, we are going to be doing a SNAP in Schools pilot project with school-based health centers. So what we are looking for is we're looking for teams in Kentucky to work with us. So if you want to do that kind of level one outreach, great, wonderful, encourage you to do it. But if you're like, you know what, I want to take on this project, I want to do a little bit more than just outreach. I want to connect with Chelsea. I want to, start implementing other ways to improve food access to our students. Then that's kind of where you come into play here. So you would work with your state team, school-based us, the School-Based Health Alliance, and No Kid Hungry, where we would help you kind of develop or come up with different workflows, data collection, and communication plans. And so this is why it takes a little bit more effort and capacity, is we will be asking you to report back some de-identified data, just so we can see how the project is going. We will offer some quarterly trainings and support. So we're not just going to send you out there and say, hey, figure it out. Like, we want to provide you with trainings that will help support the work. We also envision having some coaching calls and some office hours, just kind of like every other month, just to be there because like I mentioned earlier, we've been doing this for like 3, 4 years, and so like we have learned a lot over that amount of time, and so we have seen kind of what it takes at the ground level, and so we want to be able to kind of be there to support you through this process. We will be, like I mentioned, collecting some data. And so some of the things we want to be real upfront with our data requests. And so we would be looking at you to kind of be able to track your outreach activities and the number of households that you reached, the number of referrals. So these would be like referrals either directly to Chelsea or to another food assistance. Um, we'd want to be able to capture that. Warm handoffs completed. Before I came to the school-based health center, I worked, or the school-based health alliance, I worked in a school-based health center where it was so important to be able to have those warm handoffs, especially if I was referring outside of the clinic. So, I remember I had a relationship with our local WIC office, and I would, help the student or the family make that initial referral. And if they didn't hear back, or if there was like a delay in the referral, then I was able to reach out myself and say, hey, so and so reached out. Did you get the message? Or really encouraging kind of that warm handoff and that connection to those community partners, I think is really important. And then helping with the SNAP application support and follow-up. So I think Chelsea did a really nice job of laying down like all of the things that are required for the SNAP application, which I think can be intimidating for families. But if you have somebody who can really work with them through that process, I think is really helpful. And then participate in other trainings and other partner meetings that we may have. So the next slide kind of talks about the level 2 kind of outreach and screening referrals. So this is where we would look at kind of implementing or strengthening food security screening within the SBHC workflow. So I know that all different school-based health centers use different screening tools, especially as it relates to health-related needs such as food, transportation, other social determinants of health. And so really understanding which tool that you're using and if you're not screening for food security, making sure that maybe we're introducing the hunger vital sign, or maybe we're introducing other screening tools that can really get to that. And then integrate those into traditional like medical and behavioral health visits. So I was a behavioral health provider, and the amount of times that we talked about food was actually quite frequently. Not only did I provide the snacks to my students, I also would talk to them about kind of ongoing food related needs and issues. And so as a social worker, I was often the one kind of assessing that student for their food related needs. And then establish those referral pathways, and then track that screening and referral data. So this is where we're really focusing in. So doing the general outreach, so that level 1, and then including level 2, which would be kind of looking at your screening process, doing those warm handoffs and tracking those referrals. So in order to do that, we would provide some stipends. We also would give you some training and support around the best ways to capture that data. And then we also have, from our work with school-based health centers over the last several years, have some templates and sample workflows that we have found to be really helpful. And then just that quarterly learning clue, we would offer that additional support to you as you're going through this. Level 3 is doing everything that you would do in level 1 and level 2. But we would also kind of step it up a notch. So Chelsea mentioned she is only one person, right? And so if there is an interest in your health system or health center, to designate and train specific staff to provide SNAP application assistance, that would be amazing. We also recognize that that might not always be possible. And so just really kind of assessing your system and your workflows, if that would be something that would be attainable, great. If not, we can also look at how you can define just different staff roles and how you can really maybe integrate the SNAP assistance as part of their role in the school-based health center. Again, we're looking at like tracking, so making sure that we're really tracking those numbers, and then a plan for sustainability and follow-up. So this really just kind of takes it to that next level. And again, we would be providing those stipends, training, learning collab support. And then you would also receive additional support from Feeding Kentucky. So, I don't know, did I miss anything, team, in describing those levels?
I think you explained it all really well. There's one if for some reason, maybe you have the capacity to do the start of the application itself, just the initial application, but you might not have the capacity to do all of the follow-up work that goes after that. You could always do the initial application and then pass along to myself or to one of the folks at our food banks doing this work to do that follow-up process and the continuation on with the individual instead of doing all of that on your own.
Yeah, I think that's a really good point. Thank you, Chelsea, because I think that can be the part that takes up a lot of time, right? Is like following up, trying to get the right paperwork and trying to make sure that you're connecting. And um, again, I was a school-based health center provider, so I know the limitations on time and capacity. And so we want to make this as easy for you as possible and are also willing to adapt to figure out what's going to be feasible in your setting. So, and Chelsea was absolutely right when she said, when you see one school-based health center, you see one school-based health center. So, that is definitely a really great point to just say, like, we are willing to adapt and work with you and figure out what's going to make the most sense in your particular setting. Next slide.
Alrighty, everyone. Thank you so much. I hope this was like interesting and engaging, and this is maybe like starting to create some ideas in your mind about what you can do. I'm gonna launch a quick poll. It's just a couple of questions to kind of gauge interest and see where all of you are landing. The last question is to confirm an email contact so that we can get in touch with you with updates about the RFA or the outreach materials that Chelsea and Feeding Kentucky provided earlier in the presentation. So you can go ahead and get started with that outreach now. That being said, if you know that your colleague or maybe someone that you work with might be the better contact person or an additional contact person, you are more than welcome to add their email as well as yours, or just put their email, whatever you think is best. This is also a time that you might want to start thinking about some questions. We do have time for Q&A, and we would love to hear from you to know what's unclear, maybe curious about what next steps look like, what timeline looks like. There are no wrong answers or bad questions. We just want to make sure you all feel prepared for the upcoming RFA if you're interested in getting involved in applying. So I'm going to give everyone a little bit more time to finish filling out the poll, but feel free to unmute, chat, say hi. If no questions are coming to mind right now and you're thinking you might want to digest, maybe bring this information back to, as I was talking about a colleague, that's totally fine. Yeah, I will go ahead and put our emails in the chat and then also reach out with those follow-ups that I was talking about. And you can kind of go ahead and get in contact with us that way. We do want to make sure that, again, all of your questions have been answered, and we're making sure to connect you with the lovely Chelsea and her team. Alrighty, with that, I'm going to go ahead and continue to highlight our toolkit resource. I did put the link in the chat a few times, but again, I will follow up with the link to this directly. It's got some great examples from all of our work that we've been doing since 2021 and the work of all of the amazing sites that we've been partnering with. So hopefully there's some information in there that will be useful for you as you embark on your journey or continue to work on this. I also do want to highlight that we have open registration for the 2026 National School-Based Healthcare Conference. It takes place in Washington, D.C. this June. We would love to see you or someone from your team there, connect with you in person, and hopefully just keep learning more about what we can do for students, and continue to work hard for their health. You can also find more resources, events, etc. on our website, on our social media, and through our biweekly digest. We've got an edition going out tomorrow with more information about upcoming events and our conference. So be sure to subscribe to hear about that. And thank you so much. As Sarah said so perfectly in the chat, we are really looking forward to working with school-based health centers in Kentucky, working with Chelsea, and continuing to yeah, keep students healthy and connected through SNAP.
Thanks, everyone.